Okay. Hello, everyone. Thank you for joining us today. Welcome to our webinar on presenting a countywide community partnership database in Jefferson County, Colorado. We're very excited that you're here today. We're calling in from snowy Colorado. I just looked out my window and it's actually snowing outside my window, which is a bit unexpected. I did think it was going to be cold and rainy. So I hope wherever you are, you have maybe a little bit more sunshine. But what I would love to invite everyone to do before we even get started is we love to connect the dots right away. So if you feel so inclined, please go into the chat and introduce yourself. We have folks here from a lot from Jefferson County, Colorado, but from also all over the country. And we'd love to know who you are, what kind of organization you're affiliated with, and feel free to say why you love partnerships or collaboration. I think what you'll find is we have so much commonality even across different sectors. So we have folks from health and education, environmental interests, all coming together around the same concept of how do we actually track and learn from our network connections over time. But I am very happy to be here today. My name is Danielle Varda, and I am the CEO and founder at Visible Network Labs. Prior to that, I've been at the University of Colorado, Denver in the School of Public Affairs for a number of years and the RAND Corporation before that. But my entire background, I've been a network scientist with a focus on how we build and strengthen capacity in communities to use data, science, and technology to strengthen social connectedness. So I have the privilege of leading this amazing team at Visible Network Labs who really wakes up every day to do just that. So, but today is really special because we have a really important and exciting project that we're ready to launch today. And we have a big agenda, so I'm just going to go right into it. But again, I really do hope that you all will connect in the chat. And already I see a bunch of friends here, so thank you all for joining. I love to give an agenda. So we're going to go first through the background. So what is Jefferson County, Colorado? What's the purpose of this project and what were our methods? And then we just really want to demonstrate to you our dissemination and accessibility features and ways of sharing the data back with the county and others who have participated in it. We do have next steps at the end, which are primarily around how to get involved, learn more, take deep dives, and things like that. So I will start with just saying a little bit about Visible Network Labs. Our whole purpose is to make invisible networks visible. We know that we're all embedded in these networks all the time, but they're invisible to ourselves, to the people trying to help us. And we've just really seen the power of being able to really make those visible, especially to create change for big social impact. I do have this amazing team who works on all this stuff. Visible Network Labs, we're a social enterprise. Our mission is to strengthen social connectedness at the individual and systems level for health, mental health, wellness, and economic opportunities. We do all of this by using a network science approach, and we're hoping that we can support collaborative innovation. Our key way of doing that is through technology-based data and mapping tools. And our team is made up of data scientists on one side of the house and technologists or developers, product people on the other. So what makes us really unique is that we're really intensely trying to measure and understand how to visualize and see these hard to measure things, these relational kinds of things that are happening around us, while building the technology to do it. So we have this really great interconnectedness between data science, community, and technology. So I think that makes us really unique. And, you know, we have developers who are as interested in the capacity and translation of practice in our community as our data scientists. And I think part of that, I really want to just take this moment to say why we use some really essential guiding values to do our work, because it will explain everything else that we've done here. But at Visible Network Labs, we really focus all of our work around some of these guiding values, and we have some internal ones as well. But our focus is on community capacity building. So we believe network science is the most tangible science, the science of how things are connected, and that it's something that anyone should have access to, whether you're a big, large foundation or a small organization and community members just trying to build strong connections. We do all of our work with a strong community engagement and input process using design thinking, agile development, but we're always assuming the community member that we're working with is the expert. And so we try to always bring that into our work. We use the network science principle and everything that more is not better. So we understand communities are very resource strapped. All of us are. So just telling you more networks or better networks is not a good solution. So we really try to look at how we actually can provide these kinds of data so that we can ask less of people to get the same collaborative advantage. And finally, we strongly believe in the democratization of data. If we take data from community, we believe we should find ways to give it back. So you'll see throughout all of this, we not only tried really hard to take a strong community engaged approach, but also we've built a lot of mechanisms in here to give data back through some of the features. We just believe if you're doing systems building work, if you can build the capacity of any one entity, one organization, one community partner, while doing that work, then we strengthen the whole system. So these are tenets for us that drive all of the work that we do. And although we'll kind of talk about what a CPRM is in a moment, our core platform and I hope contribution to some of the space is that we built the Partner CPRM, which is a community partner relationship management system. We call it an ecosystem data tracking and learning tool. That's really because the purpose of it, we don't believe is just to study communities or do research, but to really get data that helps us develop strategies and action steps and strengthen our work. So our purpose in this project was to really think about how to take this platform that we've built that's most often used in one network at a time and actually build it out for an entire county. So how do we take it kind of to the next level and make the data public facing, maybe accessible for multiple initiatives and multiple things going on? All right, so let's talk about Jefferson County for a moment. So Jefferson County is in Colorado. I know there's multiple Jefferson counties. This is where our organization is primarily located. And if you have been through Jefferson County, you will recognize this building. It's our county building, but we refer to it as the Taj Mahal. Most people do. And there's a little picture on the right here of just some statistics. You can kind of get a sense of the size of it and where it sits here inside Colorado. But it's a pretty regular kind of county, I think, in the sense that it's outside of a large urban area, a little bit filled with suburbs. But one thing that's really unique about it is its wide geographic span. We go from close to Denver and the city areas over there along our Sheridan corridor, all the way up into the mountains. So the county has some pretty unique needs around how we serve people. Some people are in really remote areas. And so it's a place that requires a lot of collaboration and coordination to really meet the needs of all of those people. And luckily, we were partnered with, given some funding by the Colorado Gives Foundation to tackle a specific issue that we were kind of struggling with in Jefferson County. And that's that we know that there's collaboration going on. We all go to the meetings, we all go to participate in community events and things like that, but it's very difficult to see it and to understand who's doing what, and are we all working together, are we working in silos? And what we know is that we have data on all kinds of things. We have kids count data that tells us about kids in poverty, census data, county health ranking and roadmaps, but there's no real home for the data around what we do with collaboration and partnerships. So we started talking to Colorado Gives about doing some network study work around the county. And I said to them, what would you think about if we tried to do this at the county level? And a lot of back and forth went into that because there's a lot of questions. Who's going to pay for that? Who's the audience? How are we going to design that? But really amazing that they were innovative and trusted us enough to say, yeah, let's go for it. So this is officially our first countywide, totally public facing CPRM. And so very grateful to the Colorado Gives Foundation, of some who are on the webinar today. Thank you. And yeah, and really excited to show you what we did. All right, so our project goals, as I mentioned, was to create a public-facing tool for Jefferson County community to map, measure, and track their partnerships, identify priorities, and build strategies. So we know networks are everywhere, so we had to focus. So we did use some of the Colorado Gives priority area work that they've already put into building connection in the community to focus on 4 particular areas: workforce development, older adults in isolation, food systems, and early childhood. So what I mean by that is we know people and organizations are working in each of these areas, but many of these organizations are working in all of these areas. So what we did is we said, let's actually track networks, but we'll recruit and focus on these 4 areas so that we can actually, it's a feasible project. And that was really guiding for us, limiting in some ways because we didn't include everything that we could. But it's amazing how many of these organizations are doing almost 1, 2, all of these things. So that's how we focused the work. All right, so let's talk for just a moment on why we did this project. So we know, and I think probably every single person on this call is probably knows it better than I do because you probably do it in your community. But we talk a lot about the network way of working. This used to say a new paradigm when I used to present 20 years ago on this. Now it just says the new norm. There's almost no way that you can be, especially in the public sector or the nonprofit sector, even the private sector, and not be expected to work across boundaries and build these networks. So it's become a way of working. It's a thing that we tend to expect of employees today. So for example, at a health department, we might have people who are epidemiologists. They come into work, they have that background, and suddenly part of their job description is to also go out and be a part of community networks. So what we know is that people and organizations are working in these ways. But what we also know is that there's no real way, there's no guidance for this. We don't have a lot of training. We definitely don't have a lot of data. So we do work with the Bill and Melinda Gates Foundation, and the reason they brought us to do this work is they said, we fund so many of these that we know there must be a graveyard where networks go to die. And we said, how can we actually stop doing that work without an evidence base to help inform us? So we always say at Visible Network Labs, we believe networks are the answer, right? Because what we know is that as things get more complicated, it can be hard to tell if it's working. And a lot of our organizations are feeling a little burnt out, a little understatement, a lot burnt out of doing a lot of redundant collaboration. So our goal is part of that value I talked about is how do we actually use the data to not necessarily do more of this, just to do it in a better and more equitable way so that we're not asking small organizations to do more work around networking and less work around direct services. So that's been our hope. And this kind of last part of this, I mentioned it already, but we already know these networks exist in communities. And one thing that's certain is foundations, funders, philanthropy are investing in networks. You almost cannot get funding these days without describing your partnerships, your systems approach. We also know legislators are legislating it. How many times are they saying we're going to build a network or a system to solve a problem? So it's happening everywhere. And yet we don't have a source of truth, a home for this. And so our hope is that we can stop collecting the data over and over again from disparate parts of all of these networks and kind of agree that we could put things in one place and then make it accessible for everyone. So that's kind of our hope. And the way that we are trying to solve this problem is through this process called a CPRM. So I already kind of showed you this. This gives you some insights into what we'll show you in just a moment. But we do use an approach that collects and tries to understand who all the members of an ecosystem are and then how they're connected. This is really, CPRM stands for Community Partner Relationship Management. And it's really a practice of tracking members of an ecosystem, their attributes, and the relationships between them. And one of the things that we try to really encourage and support is that CPRMs are meant to empower a network to engage in database decision making and the kind of work we can do. So it's not necessarily for an organization, which makes it really different from like a CRM. So a CRM is a customer relationship management system. Those are built to convert people to paying customers. None of us are doing that work in community building. So we the reason we started to build the partner tool into the CPRM is because primarily it was our public health departments who were using CRMs and said, we're doing okay with that, but we don't really have a way to connect the dots. How do we know if we're building community, as is their mission? So that's been a really helpful kind of way for us to help distinguish what we're doing and just really like who the customer is, who's the user for this. And it's pretty distinct in those ways. And last thing I'll kind of explain about this, because you're about to see a lot of these, is that, and I've mentioned we use network science as a framework already. Network science is just the science of how things are connected. And one of my favorite things to say is that you already are a network scientist because you are a human being, and all of us spend most of our day trying to navigate relationships and figure out where to invest time and not invest time and what's working and what's not working. And that's what we do in network science. What we do that's a little unique is we map them into these nodes and lines, and we do that because we measure it. So this is something you'll see throughout our dashboards when you get into those. You'll see these circles, which represent usually organizations in our work, but they can be people. There's attributes about each of the organizations that help explain things about them. And then the lines between them tell us how they're connected. So that's all the data that goes in there: members, their attributes, and the connections between them. And then we use that to try to make sense of these networks. And I'm not going to go through this. If there's plenty of resources we have on our website. I give a talk called Thinking Like a Network Scientist, but I kind of just like to show something really quickly here to describe, because we can show you the data and the technology, but if we don't understand what it means and how to translate it into practice, it's really hard to understand its value. So I like to just briefly call your attention here to these squares and circles in the middle of this picture here. What you'll notice is that in every picture around it, they are in the same spot. And the only thing changing are its lines between them, the connections. So what we see in almost every community is that when, let's say, a funder says we have a great idea and we want to invest in a network, people get together and they make a list of who's not already at the table. And very quickly, we connect those people to the work. And that's network building. And then VNL, we meet almost all of our communities here in phase 3, where the strategy is to grow the network. But what we've learned is that although there's usually a backbone, there's a lot of free riders. People are in about 10 of these across the community, and we start to lose a lot of energy and they're very hard to sustain. So what we do is try to help folks move into configurations, plans and strategies that allow them to have maybe the same collaborative advantage, but with fewer connections, and strategies that allow them to actually do a little less networking, but get the same advantage. That's a very brief, quick overview of this. But my point in really bringing this up is to say data is data, right? And if we can't use data and translate it into something, into our work and our workflow, it's really hard to use. And so we hope that by building CPRMs, by helping folks understand the data that they're seeing, they can actually do this work in ways that's more successful. So that's kind of how we connect the science to the actual data. And this is just a little bit, if you like data architecture of software systems, you might appreciate kind of these little parts of the system that are important. And so to get information into a CPRM, we have to have data entry. So some people will bring in a whole list of organizations and all of their attributes. Others are doing that one by one. We have an option to bring in geospatial data so we can see where these organizations are. And then we have what we call relational captures, which is a way, usually through a survey, to connect the dots to make the connections between those members of the ecosystem. And then there's lots of ways to manage the data when it's in there. We call it member management. And there's workflow considerations. So we have, for example, some health departments who are using this to track their connections with their community partners every day, versus the way we did this, where we would only collect data at milestone moments, big points in time. And then this data visualization and accessibility is a key component of what we're building here. Making sure that people have access to the data and ways to see it is the only way to get to these kind of smart, powerful analytics to help us build insights. And lastly, I will just point out that I mentioned that we believe in the democratization of data, which means that there's ways that we should be able to give the data back to folks that's public. So you'll see here a little bit of a scale. In the partner CPRM, we have the most private type of data, which is like the admin side of things where you get to see everything behind the scenes and get to make edits, for example. And then to have some publicness in the platform, we offer things like a read-only access where people could see a lot but can't change things, and things like reports. And the most public way that we could share the data is through data dashboards that are public and what we call member profiles. So for the rest of this presentation, we're actually going to walk through these three ways of seeing the data. So the most private sense, some private and some public, and then the most public. And this really tracks what our priorities have been around this work with building the CPRM. And I can't say help myself but say we have a bigger vision, and we hope that we can inspire folks to build their own county-wide CPRMs and maybe even a statewide CPRM, so that we can actually stop collecting data in these different siloed ways and really use it collectively as a community. So a little bit of a bigger picture there that I like to bring in. Okay, to do this Jefferson County CPRM building work, first of all, it was absolutely important to us that we take an intentional community engaged approach. And we know that if we want to build a tool for community members, the community must drive the process and they must be involved. So, and luckily, Colorado Gives Foundation is very embedded in the community and really helped us facilitate that kind of approach. So it was a really great partnership. I mentioned that the way we got started was we had to take a whole county of partnerships and put them into some feasible way of looking at them. So we picked these 4 areas. We did interviews and community presentations for about 4 weeks. This ended up we've almost never stopped just talking to people in the community, putting things in front of them, getting their feedback, presenting at community meetings to really just try to understand what they would find valuable in this. We checked language with them that we were using, all kinds of things. So in these first 4 weeks, we did this. We made a list of organizations, and that was really important that we could upload into the Jeffco CPRM. And that list of organizations was generated through our community and Colorado Gives partnerships. So we really asked folks in each of these 4 areas, leaders in those areas, to give us input and make sure we weren't really leaving anyone out. And the way we defined a member was an organization that served people in Jefferson County. So they could be located in Jefferson County or outside, but they all served people in Jefferson County. The next part of our work was to create a question set that would let us capture data that would help us do this work that we wanted to do. So VNL comes with a whole bunch of library of questions that we can use in these, but what's important is to really modify it and customize it for this particular community. So that's where we again used our partners at Colorado Gives, but also with community, we went to them with the questions, especially to look for cultural competencies, making sure we weren't leaving things out. And we tried to include at least one question from each of the leaders in these 4 areas that was specific to them, that they said if we had answer to that question, it would really help us in our work. So we continued to do that until we said we're finally ready. And then about a subset of 100 organizations were invited to participate in the process. And we had 69 respond, and they generated 1,742 relationships. So we just got an enormous amount of data of what's happening in the county. And just to kind of be really specific about that, we wanted to talk about just these different kinds of questions that we brought to community that we thought were important before we made decisions about how we were going to do this. So I mentioned that bounding the network and reviewing the survey questions was what we really focused on. When we met with them, we would ask them, how do we encourage engagement in this? How can we get buy-in? How do we get people to value and trust this? So what do we need to consider? What were their ideas for engagement and how we explain this? what are existing events and ways to communicate with people. So those were some of our strategies. And then we really focused on asking folks, how can we help people, or think about how organizations will digest, interpret, and use the data. So we would ask, how can people use the data? What would be valuable? Will they use it? What will support use by the community? So these were the kinds of guiding questions that we used, and we just continuously tried to make sure that we were on track. The one hard part is, we get tons of feedback. We can't take it all. So we did the best that we could, though. This timeline, I'm only going to sit here for a second, but what I wanted to kind of show you is that we did project design work, and you'll see where we revised over and over again. We noted some of our community engagement. You'll see I had to kind of move this in our timeline. It was earlier, but it's a little later now. We did data collection as a phase 1, and then we paused. We reviewed all the answers. We reviewed the feedback, did a ton of data cleaning to try to really get it right. And then we did phase 2. So potential for doing a phase 3 or a special module is there. We've done reporting in November. We did some preliminary reporting, and then we've done all the reports, which you'll have access to now, and started working on the dashboard. So we built a manual that's available for folks to use, and we'll just continue to do additional capacity building and thinking about how to keep the platform really sustainable and relevant. If there's folks who want to do deep dives or additional data collection, we want to be able to do that. All right, so I am going to do one of the harder parts of this, is going live on a dashboard in the middle of a webinar. So I always like to ask for grace, as I might fumble through this a little bit. But we're going to do 3 things now. I'm going to show you the dashboard, which I need to log into because I've been out. And then I'll show you some of our results. And then Andy Zhang, who is on the call with me, who is a data analyst from Visible Network Labs, is going to take over and walk you through the public-facing dashboards. He's amazing at walking community members through. So this is going to be like a teaser of what the dashboard would look like. We just want to make sure people know what it is when we said we were doing this. So all that work to identify the members allowed us to make a list of members inside the platform. So you'll see there are 213 in here. And those members represented the list that we put together. So we have lots of information about each of these, sometimes an email address. We have the ability to actually filter and find, some information about them. So for example, I could say, let's look at all of the organizations that are part of the early education childcare sectors in Jefferson County. And we'll see those listed here. We have 19. And then I might say, now I'm really interested in those that serve housing and homeless, provide housing and homeless services. So then we'll get, whoops, what did I do? We'll get a little bit of a smaller list to, let me see. I'm doing something weird with my filter. So let me pick another one here, family services that serve housing and homeless. I may just not have any in those categories. So, so for example, that's one way that we can kind of filter through and navigate and see these organizations. However, there's lots of other ways to see the data. So I'm going to go ahead and step into that. And what you'll see here are some options at the top. For the sake of time, I'm just going to go straight to our member list. And what you'll see here is we actually can look a little bit more closely at a member. So let's say that we're interested in who our chambers are in our county. And thank you to the Arvada Chamber. They always let me use them as an example. So what I just did, I was over here and I clicked on this Arvada Chamber button. And so here what is happening is I'm opening up their member profile. So what's really interesting, fun about these is that we have information about that organization, including things like their network maps, how they're connected to others, some of the information about like how they're who they serve and things like this. Andy's actually going to walk this through with you in a little more detail in a little bit. So I just kind of want to show you this as a resource at the moment. But I will say the reason we built member profiles was because our users said, is there something we can give back to people when we're asking them for their data? And this really started to help us dig into our belief in the democratization of data. We know that community members are often asked to answer surveys. And what we also know is that it just usually goes into a black hole and they never see it again. So we think it's really important. Can we provide something back to them? And these data are interesting because they talk about their partnerships, how they're perceived in communities. And we've seen a lot of folks use these data to apply for their own grants with data that can say, this is what we look like. We've had the Robert Wood Johnson Foundation say people use partner data in their applications. We've also seen organizations use it in their annual reports or on their website. So this is our thank you to community and our real belief that they should see the data that they actually get to provide. So that's what member profiles are primarily built for, but Andy will show you how to navigate them in just a moment. So I just came into our analyzer, and again, I'm only going to be able to show you a very limited part of this platform, but this is actually our Jefferson County platform. What you're going to see over here is that I can look at nodes, their relationships, and other things about them. But anything that we bring into the platform that is a question or an attribute gets populated over here. So that makes it really easy to use. So you'll see here that I've said, please color the nodes by our primary sectors. And these are the ones that I can see here. So let's look at, for example, food. I know we have some food folks, food systems folks on the call as well. So this is a map of all the organizations that were tagged as food systems, offering that as a service. So that someone may be tagged, this is their primary sector, so they're only tagged by their primary type here. Other places we can show that they might provide various services. But I might be interested, for example, in number 88 here. And I can see that's the Jeffco Food Policy Council. If I clicked here on the eyeball, I'd go to their member profile, but it helps me to see kind of that they're a big connector here in this food systems network. But let's say, and one thing I will quickly show you, the lines between here are those that are have been answered. What kinds of activities do you engage in with this organization? So these are all of the activities that they may engage with together. But if I come here and say, let's just look at those that exchange general information, then we get the general information map. And if I say I'd like to look at who does client referrals together, not as many, but we can start to see who says that. I can come and show my arrowheads, and that will let me kind of see who said what that they do together. So let me go back and actually pick all of them again. So we get the whole map. But let's say we're interested in how the food systems are working with housing stability and homeless organizations, homeless serving organizations. So now I draw that map and I see something interesting. They're not all connected. We have a little subset here. So what we know in Jefferson County is there's so much collaboration going on. But what we're learning through this data set is that it's not all connected or coordinated. So there's tons of opportunity for building relationships, but also looking for redundancies where we can maybe strategize a little bit better. Okay, so if I bring in, I'm going to do one more here that I find interesting. I'm going to go ahead and bring in our public health department. So I have public health and all the ways that they connect together. So these are the organizations. We don't even have them all connected as one big network. But something I learned in Jefferson County, the schools are really close to my heart. So I am going to bring them in and go ahead and redo this. But what we know is, if we think about, for example, COVID, we knew that the schools and public health started to build new profound relationships that they never had to have before. So we were really interested in, well, what does that look like today? And do our schools have strong relationships or relationships with public health? So what you'll see here, our schools are our blue nodes, and they're pretty connected, but our public health nodes are as well. But again, we're seeing another example where they're not very integrated. So we have some organizations like 155 here, which is the Colorado Department of Public Health and Environment. So our state public health department, that's bridging a little bit of our schools and public health sectors together here. If I bring in, for example, early education and childcare, and I look at that, what we start to see is actually a little bit more integration. You'll see the schools are going to fall down there as still a bit siloed. So something I've learned about our schools here in Jefferson County is that they're not as integrated as we would hope they would be. Here you'll see a lot more integration between early childhood and public health, for example. So we do see the connections, but there's just tons of opportunities for building those out in a little bit stronger ways. So these are just a couple of examples. You could imagine I could go into depth in so many ways here, but I'm not going to because we don't have time. Instead, I'm going to just show a couple of little last features in here. So if I take a few of the features off here to make it a little easier to see, we are connected to ArcGIS, so we can start to look at kind of where these organizations are in the county, how they're connected. And we have a base layer here from County Health Rankings and Roadmaps that's just showing kind of where our older adults are situated in the county. So there's a feature there that's useful. We can start to see things like how many connections different organizations have reported either out or in. And then also we can just look at the data in terms of what we're interested in around, for example, resources provided, things like that, or crosstabs that allow us to look at things like the primary sector I was just looking at, and maybe what cities they provide those services in. So lots of great ways for someone to see the data. And over here, you'll see that there's actually a couple of reports that just live live that allow us to dig in a little bit more. All right, so I'm going to stop there, and the, whoops, I meant to share. Okay, so that's like the most private, I think, way we would describe, or less public way that the data exists in the platform. The people who get to see that side of it that I'm showing you are admins, and then we have read-only access. Right now, we haven't given read-only access to too many people in Jefferson County because it really takes some capacity building to go in there and navigate. So we are looking for people who are interested in having that access, who might want to be able to serve as a resource in the community for others to be able to kind of search through there as well. So we'll have a way that you can say you might be interested in that in a bit here. Okay, and then here, I'm just going to go to kind of the just a couple here of the findings from all of this work. We've done some analysis and we have some reports. All of this is in the report, the big report on the data that you can find, the very long report that you may or may not want to read. I'm going to go through them kind of quickly just to demonstrate some of the things we've learned. Like, we've learned how many organizations said they work in each of these areas. And then of course we can dig into that a little bit more. This was a question that asks, of all of these different kinds of resources that folks provide, which one do we have too little of, just the right amount of, too much of, or not sure? So interestingly here, you can see the advocacy and policy change and community organizing or convening were both listed as almost having too little of, with community organizing also saying we have quite a bit of it. So really interesting to help us build some priorities around where we want to spend our time. I've mentioned that we organized it into those 4 areas, but I wanted to call out that we also focused on mental health and housing and homelessness. So we have a lot of data on those organizations and how they're connected as well. For example, here's our 29 organizations that said they provide mental health services and the kinds of services they provide, and the 19 organizations that said they provide housing or homeless services and the kinds of things they provide. We included this other category down here because so many said they do something other than these, which told us we might not have gotten all of those uh, response options correct. And this is just when we ask people, what do you do that we just didn't include? And the number one thing here was creating a sense of belonging or neighborliness and access to basic needs, family strengthening. You'll see those here. Finally, when we asked people what the barriers or challenges were to building this system out in Jefferson County, you'll see that the one that rose to the top was those that said a lack of a network-wide community-centered approach. And this really, I think, helped us understand that while we do a lot of collaboration in Jefferson County, we may not have a community-centered approach. One of the reasons for that might be the lack of geographic focus that spans the county. We are a huge county. So this is an absolutely fascinating set of data that we just love to continue to dig into. I'm only going to do one of these so I can pass it off to Andy, but I just really wanted to close the loop here on who, great, you have data. What are you going to do with it? So we just looked closely at one topic, advocacy in Jeffco. And the reason we did that is because I just mentioned when we asked what there was too little of, advocacy and policy change rose to the top. So we said, wait, let's look into that, because when we asked people what they provide, about 50% of them said we do advocacy and policy change. So we were a little confused. We thought, why are people reporting that as a resource we don't have enough of when we have lots of organizations that say they do it? So we went to our network maps, and this map, the red nodes are those organizations inside Jefferson County. The green nodes are those just in Colorado, anywhere else. And these are all these ties, all these lines you see are all the people who said we do advocacy work together, collaboratively. And again, here just in Jefferson County. So we just kept scratching our heads. What is going on here? So we just used one last data point, and we're going to call out Colorado Succeeds here for a second. This is a map that showed what people said their most important contribution was. And only one of everyone picked advocacy as their number one resource contribution. So we thought, and this is a little assumption, we'd love to dig into this with the community, maybe we just don't have enough leadership around advocacy and policy as a primary focus. There's only one organization that said it was their primary focus. All of these said they do it. So maybe we just need a little bit of a focus and priority area on it. So that's just one way we can walk through the data and see how to use it to really kind of uncover and get some ahas out of this. Okay, so what I'm going to do is actually skip through this one, hand it over to Andy to talk about the public-facing resources. And these are the resources that you can dig into right now. I think we're actually asking you to wait till the end of the webinar so we don't overload the system and any surprises like that. So I'm going to stop sharing, Andy, and let you share your screen. Are you ready?
Yeah, could you allow me to share?
Oh, sorry about that. Let's see.
Danielle mentioned that until recently she has been a professor at the CU Denver's School of Public Affairs, and I was actually one of her students many years ago, not that many years ago, just before COVID. And the class that she taught me was collaborating across sectors. So it's really fun that many years later I'm still working with her, helping Colorado organizations and communities collaborating across sectors.
Yeah. So Andy, I think Alex needs to give you permission. Oh, you got it.
I got it.
Thank you. That's the behind the scenes work going there. Thank you.
Awesome. Thank you so much. So we have done so much work collecting and cleaning and preparing the data, and now we just have so much to share. As Danielle mentioned, this is really a way for us to give it back to the community, like the data that they have. So we built out these public-facing dashboards. There's one for the whole overarching Jeffco CPRM network, and then we built one each for the 4 priority topic areas, from workforce development, older adults, food security to early childhood. So real quick, in light of time, I would just go into the workforce development dashboard and walk you through it and see how we can use this data to demonstrate what was going on. Um, so across the whole network, there were 38 organizations that we identified that they provide workforce development services. And we further asked a question, what kind of workforce development services they provide. And here's the breakdown. Most do some sort of employment or workforce development, followed by career coaching and support. Some do business support and resources, a few do economic development, and some do talent acquisitions as well. I guess the next one is that we're wondering how these services are distributed across the county, whether there are inequities in some areas, some cities. So we did a little bit of a breakdown by another question they've also answered is that in what city do you provide services? So from Arvada to Edgewater to Golden, Lakewood, all the way to Whitridge. What we're seeing here is actually there is not a ton of differences in terms of where these organizations are providing services. There are about just as many that does business support and resources in one place as another. So that's a really good result to share. And here's a quick overview about how to read a network map again. But we are now showing a network map that's really about the organization's primary sector. And these are all the organizations that the 38 organizations that provide workforce development services. And you just judging by the colorfulness of the map, you know that there's a wide range of sectors, organizational types that are doing workforce development. Quite a few of these are this blue, lighter blue color, and that's employment and workforce, pretty obvious. Also, economic development, for example, this is Arvada Chamber of Commerce. They definitely do workforce development. And we have public health organizations, along with schools and other types. And at any time, like I can click and check which organization this is. I can even open their member profile as Danielle demonstrated a little earlier. So this is the Avada Chamber of Commerce, their member profile. We have the organization's network map, how they are connected to the rest of their connections on the left, and then the whole entire network that's on the right. So you see the relationship of one organization and the members they identified in the context of the larger network. I can zoom in and really look at the connections. Just going back to the dashboard that's public facing on workforce development. In the next section, we have something about centrality. That's really the ways that organizations are connected to others, to what extent they've selected the most partners, to what extent they are selected by others. And these are the top organizations who are seen as central and influential in the network. Here's another view of the same workforce development network map, but we are now coloring the each node based on the top resource contributions that they reported. And we see a lot of expertise in services. That's the screen color. We also see, for example, paid staff that were the top resources contributed. And at any point, I can really take a closer look at the member profile of each of the organizations that are identified. This one is taking me to the Colorado Succeeds, which I have opened here. So it's truly interactive. You can see in what context you're in the network map and take it straight to you to the member profile of the organization that's identified and see what answers they have provided and the attributes about them. Oh, I love this part. So in the survey, we asked organizations to report their partnerships and also the activities they share with their partners. So based on that, we can filter the network map based on those activities. So all of those organizations who reported they do client referrals, I can filter that down to this within workforce development. These are all organizations who reportedly they are sharing client referrals. So if I were looking for other organizations to work with client referrals, I will come here and see who these are and how I can get better connected to them. Here's a similar one about data sharing network. You can see it's smaller, it got fewer nodes and relationships involved. Here's the advocacy at network, also quite large. And the smallest one we're showing here is the technical assistant network. Understandably, fewer organizations and relationships are sharing that together. But if I want to get involved, I want to see who these are and if there's a way for me to get connected to them. And I can come here and open their member profile and see what else they're doing and who else they're collaborating with as well. Here is a final chart about perception of success we want to show. It's really about based on the type of services you provided, if there's any difference we're seeing in terms of their perception of the success of the overall network. And those among workforce development, the most reported response option here is more successful than unsuccessful, which is consistent with the rest of the types of services provided by organizations as well. We aren't seeing anyone who's reporting the network is completely unsuccessful or completely successful. So there's mix of good and bad, and there's definitely progress to be made in this area as well. This is just a very quick, brief overview of a way to share all this data back to the community. And I'll pass it back to Danielle.
Okay. All right, we are going to spend the last part here just answering any questions. Let me go ahead through some of these. We have a whole bunch in the chat, so feel free to put them in there. We're pretty informal also, so if I'm reading your question, feel free to come offline and share in the conversation. But I'm going to start going through them. So the first one says, are there ways to show individual connections within and across organizations? Oh yeah, I think we showed that in here. There's ways to filter the maps, but mostly by attributes. So that's one of the things we can demo if we take you through a deep dive. There was a question about whether the data will be updated periodically. That's our hope. One thing we did not do in this version was use our measures of value and trust. Those are measures that are used. We have users of the CPRM across the country, and almost everyone does the value and trust scales. We didn't want to start with that because we wanted to make the data really comfortable and safe for everyone, and perceptions of trust and value can really go down a different path there. So we wanted to hold that. So my hope is I'd love to do a trust module maybe one day, or one on immigration services or things like that. And so that's the kind of thing we're hoping that there will be enough interest for and community ask around. So we'd love you all to actually propose those things and use it for those reasons. So there was a question, did we include nonprofit organizations that have online services outside the county? And we did not limit that. We didn't specifically ask for that. So we just said, do you serve, who are the folks that serve people in Jefferson County? And we do know that some people included those that have online services. Let's see. There's a question about is there a cost to communities for read-only access? And there is not. And so that's where we would ask you to get in touch with us. The cost is a little bit more around your time and our time in capacity building. And so we just want to make sure that if people are in there, they're not super confused and I don't know where to go. Just working, all of our Colorado Gives partners have that access, and they've been working with us on feedback and ideas and ways to improve it. But it really made us realize that we needed a little bit of some extra thought into that. So we're just interested now, if you're interested in having read-only access, how we can work with you to build some capacity. And we'd ask you to kind of be an expert, like a librarian of this, to share it out. But the dashboards are available to you, and Alex here is sharing some of the links to that, and the member profiles are as well. So those you'll be able to kind of click through without logging in or having any specific access. Let's see. The last one here, so it's a little bit harder. It says, how do we stop recreating the wheel when it comes to overlapping services? That's the first one. So maybe I'll just go one at a time. There's nothing almost that we care about more at Visible Network Labs than how do we stop just doing the same thing over and over in these communities. We just have a lot of empathy for those small organizations that actually don't have budgets to engage in networks and collaboration all the time. And we, though, also don't want them to feel left out or not represented. So the key to this is really to ask, how do we become more efficient? Reg is who put this in there. I hope that's okay. I said your name. We really empathize with you, and I think that that's the work we're hoping to do together. Is think about how do we use the data to do that. Let's see. Your second question says, how do we merge like service providers? And who leads this coordination when we are all fearful to tell anyone what their role would be when we try to work together? So there's a lot in there. I think we should have a call offline. But what I really want to honor is you just really calling out that there's a lot that's really complex. There's competitiveness in this. There's just having to show that we are there and that we are doing our work and connected to everyone. There's almost the fear of missing out, that if we're not there present all the time, we'll miss out on an opportunity or something. So I think the idea of addressing those complex things means we have to have some kind of hard discussion. So we need leadership that wants to use data to really drive those conversations, I think, and then bring them to community for conversation. It's not all in the numbers, of course. It's the context around it that really matters when we start to think that through. Okay, I'll do this last one and then just see if anyone has an kind of one they want to say. This last question says, how is this going to be kept current in the future? So all data is only as good as the quality of it coming in. We always say garbage in is garbage out, and then how well we can update it if it's meant to be kept over time. And one thing I will say is we really pride ourselves at Visible Network Labs of having really high quality data. It's important to us that we don't give communities things that are not really high quality, because then we're just kind of wasting everyone's time. How we keep it current. So right now we've date stamped a lot of this. And so what our hope is that we'll generate enough interest of doing this together. So instead of having one over here and one over here, right now, just to be really honest, we're doing about building 5 CPRMs in Colorado that are in different parts. We have an Adams County one that we're doing with the health department. We have a couple with the Office of eHealth Innovation and CDPHE. And I'm constantly saying, can we get this together? Can we all do this at one? But we have different funding streams, different boards, different interests. It's going to take a lot of work, I think, to build a vision where we say, let's get all of our data in one place so we can use it as a collective. So I think that the more that we can get interest, and funding is important for both those that participate, those of us that maintain the work. So that's kind of one of my main hopes, is that we can get the energy together to build and keep it current. So it's a great question. All right, we just have 2 minutes here. So I wonder, is there anyone who just wants to raise their hand or ask a question live? Please don't be shy about that, because we're really open to some conversation. I don't see any. Okay. And hopefully I got all of the questions in. I just want to say, as we end here, big, huge thank you to Savane, Nathan, and Nazia Hassan. I don't see you on the screen, so I'm not sure if you're still here, but just for believing in this work and trusting us to do it. Savane, I saw you come on off mute.
No, I was just saying we love this work, and we're already finding a million ways to integrate it into everything we do at Colorado Gives Foundation. So it's an incredibly powerful tool. I'm still wrapping my head around it and learn new things every time I log in. But it's really, really powerful. It's so nice for you to share this, Danielle, with everyone. I think it'll be great for our community. I would love to see it also spread nationwide. So thank you to the BNL team for all your hard work on this and for the time.
Thank you. Thank you,
Happy to
Reg,
be
for the fist pumps. I always appreciate fun emojis and hand gestures of encouragement at the end of a
I'll
Zoom.
fist bump Reg too. Reg deserves, he does all this work without a CPRM. So
Right? Yeah. See, Reg, contact us so we can look at you inside the thing here, the platform. Just last thing I would say is please do get involved. If you go to two things. If you go to this link here, and you can just Google Jeffco CPRM and this will pop up. You can fill out a form to tell us how you want to be involved. So we're happy to onboard you. I'd love to do a deep dive with our schools, with our mental health groups, whoever, and build out some read-only access capacity members. But also, before we end, I just want to say, please also, and we'll send this deck out so you can have the links, or we can put this in the chat. Subscribe to the Colorado Gives newsletter. They do amazing work. This is only one little teeny tiny part of all the amazing things they do. So, please be sure to keep on their list because you don't want to miss all of that, those updates. So thank you all. We covered so much in this 1 hour and couldn't be more thrilled that you all showed up and decided to spend this time with us. So looking forward to connecting. Please reach out to us and we will be more than happy to continue the conversation. So thank you all. And we will see you soon, I hope.